Hey everyone, Dr. Austin here. I just want to jump on real quick and give you a little bit of instruction. I've heard a little bit of feedback about the emergency room simulator being a little bit difficult for some students, so I want to make sure that you understand how to use the simulator appropriately. So, first of all, this is the screen you will see when you enter into the ER simulator. This is before we have done anything. You can tell our time is 0, our score is 0. Your sound will be on, but so that you can hear me, I'm going to turn my sound off. Remember that you do have the ESI levels that will be very helpful. It will tell you which acuity you should select for your patient. So acuity level 1 is your life or limb saving interventions are required. These are your patients who are pulseless, they are apneic, they're intubated, they're not responsive. Acuity level 2 are your high-risk patients. These are the ones that have a new onset of confusion, lethargy, disorientation, they're experiencing severe pain or some kind of distress. Level 3 or acuity level 3 is urgent. They have many resources that they need, so they may need a CT scan and labs. They may need referrals. And then acuity 4 are your non-urgent. They usually only need one resource. This is what distinguishes that acuity level 3 and 4. Many resources, one resource. And then acuity 5 is non-urgent. These are the people who really shouldn't be in the ER. They should have went to their primary healthcare provider to begin with. Resources that you have. These are the resources that you have available to you. So labs, EKG, X-ray, CT, MRI, IV fluids, medications, specialty consults, simple procedures, complex procedures. You do not have to pick which one they are going to need, but if they need more than one of these, you know their acuity level is going to be acuity level of 3. Your patients are always random, but you always start out with some patients already in the ER, and those are the patients you see in the rooms here. Keep in mind, your nurses can only take care of certain patients. So your first 3 nurses, Mary, Sue, and Louise, you see they have LLSI, Life Limb Saving Interventions. These are your best nurses out there. They can take care of anyone. Acuity level 1 all the way through acuity level 5. They are the best. Save them for your most acute patients. Jim, Chip, and Connie are high risk. They can take care of patients who are acuity level 2 through 5, so they cannot help you if they have acuity level of 1. Acuity level of 2 through 5, they can help you. And then Sandy and Roger, they're able to help you if they have acuity level of 3 through 5. So anybody who has acuity level of 3 through 5 can be assigned to Sandy or Roger. ER rooms 1 all the way through ER room 8 is designated for people who have acuity level of 3 through 5. Your trauma bays are reserved for people who have acuity level of 1 or 2. As you can see, if you click over the patients who are already in the room, it will tell you why they're there. So this particular person fell off a bike 2 days ago. He's bruised, he has no distress, his vital signs are normal, and he has no complaints of pain. Obviously, he's a 5, and you're wondering, why is he even here? Whereas somebody like this patient has a history of schizophrenia, and he is complaining of hearing voices, and those voices are telling him to hurt other people. He's disoriented to place and paranoid. He's directable, and his vital signs are stable. So that's why he has acuity level of 2. So when you click next event, you will have some patients who appear. Based on the patients who appear, you're going to have to assign them an acuity level. He fell. I over triaged him. He's acuity level of 2. I'm not going to read these. I'm going to give everybody a 3. Okay, so once you have assigned the acuity level, you are then going to have to admit your most acute patient first. So for this patient, 1 is our most acute. Remember, we can only give it to Mary, Sue, and Louise. Well, Sue and Louise already have a patient, so I'm going to give this one to Mary. And then this one also needs to go to either Sue or Louise. But when I do that, you will see that I cannot do that because the nurse has a workload that's simply too high. So when you have a patient who has acuity level of 1, it's like having 3 patients, basically. If they have acuity level of 2, it's like having 2 patients. However, I can assign this patient to Jim, because Jim can take acuity level 2 patients. Now Jim is tapped out. I can't use Jim for anybody else. I can't use Mary for anyone else. If I wanted to switch this patient to Chip, I absolutely can do that, and that frees Sue up for another patient. I can admit this person to Roger, and this one I'm going to give to Sandy. Once you are done admitting all of the patients for that scenario, you simply hit Next Event. Notice up here, you can discharge some patients, so I'm going to discharge everybody I can, and then I can transfer patients. Well, I almost could transfer patients. Just like in the real world, sometimes there's simply no beds available, so I can't discharge them. So they just get to stay where they're at. Again, you have more patients. I'm just gonna give everybody acuity level 3 just for the sake of time. And now again, I have to admit people. Well, now we have a problem because I can't admit acuity level of 2 is up to these beds, but all of my beds are full. So now what do I do? Well, I'm gonna have to divert. Send the patient out to a different hospital because I can't take care of them. And then I can give this patient to Connie. Next event, now I can transfer this patient. I could if there was a bed available. And hopefully free up a bed. Obviously I can't, so again, I'm gonna have to play these. Again, not reading, just clicking. Well, luckily, none of these patients require a trauma bay. So I'm gonna admit some of these patients. And Sue doesn't have anybody, so we're gonna give this patient to Sue. Now let's see if we can transfer anybody. Oops. Nope, still no beds, but I can discharge some people. Again, you select their acuity. Please actually read these and select the right acuity. I have no place to put these patients, so I'm gonna have to divert these. And then I can admit this patient to someone else. I think you get the point by now. I hope this has been helpful in helping you understand how to play this simulator. Keep in mind, you should really treat these like real patients. I was clicking through and not reading and just giving everybody the same acuity level, but I'm just doing this as a demonstration. Please take your time and really read. Think about this patient. Think about what you would want to do with this patient. If you have any questions, as always, please let me know. Thank you.